let us start with this topic of Ectopia Lentis. Okay guys, what is Ectopia Lentis? So Ectopia Lentis meaning what? The meaning of Ectopia meaning, what is meant by Ectopia? Ectopia means outside. Outside the normal position is called as ectopia. You might have heard about ectopic pregnancy. Ectopic pregnancy is pregnancy occurring other than the uterus is called as ectopic pregnancy. वैसे ही there is a thing called as Ectopia Lentis. Ectopia Lentis is lens outside the normal position is called as Ectopia Lentis. There are two causes of Ectopia Lentis. One is the congenital cause, other is the acquired cause. The acquired cause of Ectopia Lentis is, it could be trauma, it could be tumor, it could be some pathologies of the eye. Whereas the congenital Ectopia Lentis, yani ki by birth, the child lens is outside the normal position. The congenital causes of Ectopia Lentis is, it might be due to Marfan syndrome, Weill-Marchesani syndrome, Ehlers-Danlos syndrome, Stickler syndrome, right? These are the other causes of Ectopia Lentis, Homocystinuria, right? In these cases, you will see Ectopia Lentis. So basically, what is Ectopia Lentis? Lens outside the normal position. I told you there are two causes of Ectopia Lentis. One is either congenital, other is either acquired cause. One is congenital cause, other is acquired cause. Acquired means what? It is seen due to trauma or due to tumor or due to some other underlying pathology of the eye. Whereas congenital causes of Ectopia Lentis, I told you, Marfan syndrome, Homocystinuria, Weill-Marchesani syndrome, Ehlers-Danlos syndrome and Stickler syndrome. Marfan syndrome. Guys, you might have seen the Marfan syndrome patient. They are usually tall. Their hands are long. Their height is long. Right? Marfan syndrome patient. Marfan syndrome patient will have many problems. One of the ophthalmological problems seen in Marfan syndrome is Ectopia Lentis, lens outside the normal position. Now, the question that have been asked in Marfan syndrome is, where is the Ectopia Lentis seen? Which part is the lens dislocated? Yani कि you are seeing dislocation of the lens, but in the which quadrant of the eye? It is superotemporal quadrant. Marfan syndrome, the lens is dislocated in what quadrant? Remember guys, Marfan starts with M. Okay? Marfan syndrome, lens dislocation is in the superotemporal quadrant. This is the remember, this is the superior quadrant and this is the temporal quadrant. With the M of Marfan syndrome, you can remember the dislocation of the lens is in the superotemporal quadrant. That is an important point. Okay. So there are many causes of Ectopia Lentis. We have discussed the acquired cause and the congenital cause of Ectopia Lentis. So guys, we are discussing the most common congenital cause of Ectopia Lentis, which is called as Marfan syndrome. Marfan syndrome. I gave you the features of Marfan syndrome. The patient will be tall. His hand span, the length of his hands is usually longer when you compare with the normal human beings. Okay? What are the other ocular features of the patient who is suffering with Marfan syndrome? One ocular feature is Ectopia Lentis. Apart from Ectopia Lentis, what else you can see in Marfan syndrome? In Marfan syndrome, you will see keratoconus. What is meant by keratoconus, guys? This is the normal cornea and this is the condition called as keratoconus. What is meant by keratoconus? Keratoconus is conical shaped cornea. Conical shaped cornea, right? So in Marfan syndrome, what are the features that you see? We see keratoconus, we see Ectopia Lentis, and this patient of Marfan's is at a higher risk of developing glaucoma. As he is having keratoconus, this patient will be highly myopic, and this patient have a large eyeball also. Due to that, they will have retinal detachment risk, right? So remember guys, you are seeing keratoconus, you see Ectopia Lentis, you see glaucoma, you see myopia and retinal detachment. Which is the most common ocular finding in Marfan syndrome? It is Ectopia Lentis. And the dislocation of the lens over here is in which quadrant? Which quadrant, guys? I told you just now is in the superotemporal quadrant. Superotemporal quadrant. Very, very important. Superotemporal temporal quadrant, right? Whereas what is the most prominent feature of Marfan syndrome? It is megalocornea. Their cornea is large. Megalocornea. So basically, Marfan syndrome patient is having ectopia lentis. His eyeball is large. Due to that, he might develop myopia. He might also develop retinal detachment. He is at risk of developing glaucoma, right? But the most ocular feature is ectopia lentis, where the lens is being dislocated in the superotemporal quadrant, whereas the most prominent feature of Marfan's is megalocornea. The second cause of ectopia lentis is homocystinuria. Homocystinuria is what, guys? Cystathionine beta-synthase deficiency, right? This is a disease which is this is seen due to cystathionine beta-synthase deficiency. Here, they will be asking you about homocystinuria about what? Where is ectopia lentis seen in homocystinuria? In homocystinuria, the ectopia lentis is seen in which quadrant, guys? Which quadrant of the eye? It is seen in the inferonasal quadrant. It is seen in the inferonasal quadrant, right? So, apart from that, patient will also have mental retardation. But the lens dislocation is very important. The lens dislocation in Marfan's is superotemporal quadrant. The lens dislocation in homocystinuria is inferonasal quadrant. Next is what syndrome, guys? Weill-Marchesani syndrome. That's the third cause of ectopia lentis. Weill-Marchesani syndrome. Weill-Marchesani syndrome. In Weill-Marchesani syndrome, I used to remember a short patient. Usually, remember Weill-Marchesani syndrome, I used to remember a short-statured patient. And I used to remember Weill-Marchesani syndrome by 5 S. First S is short. Second S is stupid. Stupid means they will be having mental retardation. Third S is stubby fingers. They will be having stubby fingers. Fourth S is spirophakia. Spirophakia. What is meant by spirophakia, guys? Spherical shaped lens is called as spirophakia. Last S is subluxation or dislocation of the lens, which we are discussing, right? So Weill-Marchesani syndrome is characterized by 5 S. Sorry, we'll start from here. Weill-Marchesani syndrome is characterized by 5 S. Short, stubby fingers, stupid, subluxation and spirophakia. The most common cause of spirophakia, right, in adults, it is Weill-Marchesani syndrome, right? Now guys, in Weill-Marchesani syndrome, where is the lens being dislocated? In Weill-Marchesani syndrome, there is downward dislocation of the lens. There is downward dislocation of lens. Once again, guys, there are three. we are discussing about what? We are discussing about ectopia lentis. Lens outside the normal position is called as ectopia lentis. Acquired causes we have discussed. Congenital causes of ectopia lentis are what? Marfan syndrome, homocystinuria, Weill-Marchesani. Apart from that, Ehlers-Danlos syndrome and Stickler syndrome can also lead to it. Ehlers-Danlos syndrome, you might have seen Ehlers-Danlos syndrome patient, but you might have not been thinking that this is an Ehlers-Danlos syndrome. Ehlers-Danlos syndrome, you might have seen in Guinness Book of World Record, where in the show of Guinness Book of World Record, where they show that a person fits himself in a small box, okay? Or he goes into the tennis racket and he can be just removed from it, and he can just move through the tennis racket hole. Is it not? It's not possible for a normal person to go through that, guys, to fit in a small box and all. But a person who's suffering with Ehlers-Danlos syndrome, then he can have those features and all, okay? So anyways, any person who's suffering with Weill-Marchesani syndrome or Marfan syndrome or Marfan syndrome, Weill-Marchesani syndrome or homocystinuria or Ehlers-Danlos or Stickler's, they will have ectopia lentis. Next is the condition which is called as lenticonus. Lenticonus means what, guys? A conical shaped lens. lenticonus. Normally, this is the shape of the lens, guys. Normally, this is the shape of the lens, right? We are discussing about what? We are discussing about lenticonus. Lenticonus meaning what? Conical shaped lens. It could be anterior lenticonus like this, or it could be posterior lenticonus like this. Okay, conical shaped lens on the anterior side or the posterior side. If you see anterior lenticonus developing, what is the cause of anterior lenticonus? Remember, anterior lenticonus starts with A. The cause of anterior lenticonus also starts with A, but which is called as what syndrome? Alpert syndrome. In Alpert syndrome, you will see anterior lenticonus, whereas posterior lenticonus is seen in Lewis syndrome. Posterior lenticonus is seen in what syndrome, guys? Lewis syndrome. So, anterior lenticonus is seen in Alpert syndrome, whereas posterior lenticonus is seen in Lewis syndrome. Lewis syndrome is an inborn error of the amino acid metabolism, which is characterized by lenticonus, microphakia and all, but the important part is lenticonus. So, anterior lenticonus and posterior lenticonus. So, this was regarding the lens and lens related pathologies such as ectopia lentis and lenticonus. Okay guys, thank you.